Hi class, so now we're going to go over the external heart anatomy. These are all the structures you have to know. You must know. So let's get started. Before we go over the structures, just a few terms so it'll help you in these structures. A sulcus is a shallow depression, and you're going to see a sulcus in other organs in anatomy also, but in the heart, there are two sulci. Sulci is just the plural of sulcus that you need to know. The first one is the coronary sulcus, and it's a depression that separates the atria, the top chambers of the heart, from their respective ventricles. And then the second sulcus is going to be the interventricular sulcus. This is telling you it's in between the ventricles. This sulcus, this little groove, is separating the right ventricle from the left ventricle. It's sometimes you'll hear it referred to as the interventricular groove. So let's look at these. So here is your classroom heart model, and here's just a diagram of the heart. So when you look at this classroom model, this is anterior. So this is the front of the heart, Here you're going to see, this is the right atrium, and there is going to be a groove that is wrapping around here. It is a depression, and this groove is the coronary sulcus. And this coronary sulcus wraps all the way around the heart. So this is just the coronary sulcus here, and then you can see it coming around this way here. It's the coronary sulcus right in through here. This is the left atrium. This is the right atrium. Here is the superior vena cava. Here's the superior vena cava on your diagram. Right atrium, right ventricle. Here is the anterior interventricular sulcus. It is a depression. Here is the right ventricle. Here is the left ventricle. On your drawing, here is the anterior interventricular sulcus. It is a groove, a depression, right ventricle, left ventricle. Now there's a bunch of blood vessels that are in these sulci, and we're going to get to them in a little bit. Remember, this is the base of the heart. This is the apex. The apex is on the left ventricle. Here's the left ventricle. How do you know this is the left ventricle? Here is the interventricular sulcus. This is the anterior interventricular sulcus that separates the right ventricle from the left ventricle. Left atrium, left ventricle. Here is the pulmonary trunk. Pulmonary trunk. This is taking deoxygenated blood away from the right ventricle and taking it to the lungs. This is going to be the left pulmonary artery. Remember, arteries take blood away from the heart, and it's going to take it to the left lung. Now, the right pulmonary artery, you can't see it. It's kind of hidden behind these structures, but here it is peeking through here. This is going to be the right pulmonary artery taking the deoxygenated blood away from the right ventricle to the right lung. Here is the aorta. Here is the aorta. This is the ascending aorta. This is taking oxygenated blood away from the left ventricle. Aorta, ascending aorta, aortic arch, ascending aorta, aortic arch. I think that's about it for that view. Now I just wanted to show you, we've already gone through the internal structures of the heart and the four chambers, but once we take off this part of our heart model And unfortunately, I don't have a picture of it. But once you take this off, here's the anterior interventricular sulcus. Once we take this off, this is corresponding to this structure in the internal anatomy of the heart. This is the interventricular septum. Remember the interventricular septum? It's the division between the right ventricle and the left ventricle. Here is the pulmonary valves, pulmonary trunk again, and then the pulmonary artery going to the left pulmonary artery and right pulmonary artery. So I just wanted to show you that. This is the interventricular septum, and that is just right under this area, the interventricular sulcus. Now, if we look at the external, the posterior part of our heart model, this is what you're going to see. And you will get confused, especially since this is a diagram. You go, where am I? Where am I? If we look at this diagram, which is you have on your worksheet, this is the superior vena cava, this is the inferior vena cava, this is the right atrium. So if we look at it over here, this is the inferior vena cava. You can see the superior vena cava way up here. This is the right atrium. This is the left atrium. Here is the left atrium over here. We can see the coronary sulcus wrapping around here, this depression, coronary sulcus going all the way around. Coronary actually means crown. So it is this area that's wrapping around the entire heart like a crown. So the coronary sulcus here, wrapping around. Coronary sulcus here, going all the way around the front of the heart too. So we know this is the left atrium. So now we have these blood vessels that are going into the left atrium. This is the right side. Yes, here's your right atrium. So these are going to be the right pulmonary veins. Here is the right pulmonary veins. Veins means what? Taking blood back to the heart. The pulmonary veins are bringing blood from where? Pulmonary means lung. So the pulmonary veins are taking oxygenated blood back to the heart, specifically back to the left atrium. These are the right pulmonary veins. Here's the left pulmonary veins, bringing oxygenated blood back from the left lung. On your diagram, left pulmonary veins, right pulmonary veins. What else? Here is the posterior interventricular sulcus. Posterior interventricular sulcus. Here is the posterior interventricular sulcus on your heart model. Bum, bum. What else do you see here? You can actually see these are the pulmonary arteries. Remember your pulmonary arteries going away from the heart? This is your right pulmonary artery going to your right lung. This is your left pulmonary artery going to the left lung. Right, left. Got it? Hope so. Now we're going to look at those blood vessels. The coronary arteries. Coronary arteries are important. Coronary artery disease is disease of the coronary arteries. These are the arteries that are supplying the heart with oxygen and nutrients. If you do not have oxygen to the heart it's not good. If you block the blood flow of oxygen to the heart, that's called a coronary, or you can call it an MI, a myocardial infarction. You have to get oxygen to the heart muscle. It is constantly pumping. It never takes a rest, so it needs constant oxygen and nutrients. So there's two main coronary arteries. The left coronary artery, and it has two branches that you have to know, the circumflex artery and the left anterior descending artery, and the right coronary artery and its two branches, the marginal artery and posterior descending artery. So let's look at these important coronary arteries. So on your heart model, these are going to be harder to see. So you have this picture actually in one of your worksheets. Now these coronary arteries, the right and left coronary arteries, here is the aorta. Here is the aorta here. So remember, the aorta is leaving what ventricle? The left ventricle. So the aorta is taking oxygenated blood and distributing it to your entire body. Yes? So once it leaves the left ventricle, this aorta is going to take oxygenated blood to your entire body. But the first organ that gets supplied from the aorta is going to be the heart. So here you see the left coronary artery coming right at the base or the root, where the aorta starts. It is getting its supply of oxygenated blood straight from the aorta. This is the left coronary artery. It is short. It is real short. It runs behind the pulmonary trunk. So in your heart model, you cannot see it. It's running behind the pulmonary trunk. Here they've cut the pulmonary trunk. Here's the left coronary artery, two branches. The left anterior descending artery, the LAD. Here they're calling it the anterior interventricular artery. You can call that because it is in the anterior interventricular sulcus, but clinically nobody's going to call it that. They're going to call it the LAD, the left anterior descending artery. LAD, left anterior descending artery. It is running in that anterior interventricular sulcus. And its second branch is going to be the circumflex. The circumflex artery is going to wrap around the coronary sulcus all the way to the back. So let's see if we can find the left coronary artery and its two branches on our model. Left coronary artery, cannot see it. Cannot see it. It is behind the pulmonary trunk. But what you can see is this branch of the left coronary artery. This is the left anterior descending artery, the LAD, left anterior descending artery, and it is in that anterior interventricular sulcus. The circumflex artery you can't see too well on this view, but it is going to be wrapping around the coronary sulcus right here and go into the back. Now the right coronary artery is also coming right off of the root of the aorta. Here is the right coronary artery, and it is going in the coronary sulcus on the right side, and it is going to have two branches. The first branch is going to be the marginal artery. Now the marginal artery is on the anterior surface of the right ventricle, right here. And here is the right coronary artery on your heart model. Hard to see. Well, you can see it there, but then the marginal artery is coming off down here. Here's the marginal artery coming off of the heart, the right coronary artery right here. So right coronary artery and its marginal artery, a branch of the right coronary artery. So now let's look at the back side of our heart model. So this is the right, remember this is the right atrium. So here is the right coronary artery. It's wrapping around. Let me go back here and show you. The right coronary artery is here. It's going to be wrapping around the coronary sulcus, and it's going to go to the backside too. Right coronary artery wrapping around to the backside. We saw one of the branches, the marginal artery. So let's right coronary artery coming around the coronary sulcus, and it's going to have this branch called the posterior descending artery. Posterior descending artery, or PDA. PDA, you cannot abbreviate, but PDA means posterior descending artery. Here we see the right coronary artery coming around in the coronary sulcus and going back down. This is the posterior descending artery, the PDA, posterior descending artery. And it is actually in the posterior interventricular sulcus. So just kind of remember where you are. Remember, this is all a coronary sulcus up here. Right coronary artery and its second branch on the back side, the posterior descending artery. Now, let's go back up to the anterior side. We said the left coronary artery, we can't see it because it's where? It's hidden behind the pulmonary trunk. Here's its first branch, the left anterior descending artery, and the right, and the circumflex is going to continue on in here, in the coronary sulcus on the left side. So here we see, this is the left side. Remember, here's the left atrium. Here's the coronary sulcus. Here is the circumflex artery continuing on the posterior side of the heart model. And here we see it, the circumflex continuing on in the posterior side of the heart model here too. Of the heart diagram, I mean. Here, right here. So those were the right coronary artery and the left coronary artery and their two branches. And now we have some veins you need to know. In this anterior interventricular sulcus, remember we have the left anterior descending artery, which is a branch of the left coronary artery. Remember, the blood flow in arteries is going in this direction. It's going down to deliver oxygen to the myocardium. Veins, the veins that drain the artery, they are traveling in the opposite direction. They are taking the used up deoxygenated blood from the heart muscle up in this direction. So remember, coronary arteries and their branches take blood down in this direction. The veins are going in the opposite direction. So in this anterior interventricular sulcus, we have the left anterior descending artery, and we have the vein that's traveling next to it. This is the great cardiac vein. Great cardiac vein is going to be traveling up. It's going to wrap around in this coronary sulcus, following the circumflex artery. So let's look at the great cardiac vein on the back side. Here is the great cardiac vein coming on the back side, and it's actually, you can see it better right here. Here's the great cardiac vein, and it's actually dumping its blood into this big dilated blood vessel called the coronary sinus. A sinus is just a big blood channel, and this coronary sinus is going to be draining blood into the right atrium. So here's the coronary sinus. The great cardiac vein is dumping its blood into this coronary sinus. You can't really see it here, but you can kind of see it here on the diagram. This is the great cardiac vein dumping its blood into the coronary sinus. The other vein you need to know is in the posterior interventricular sulcus. Remember, we have, what blood vessel is this? What's the artery here? It's a branch of the right coronary artery. It's the posterior descending artery, and next to it is a vein traveling in the opposite direction. This is the middle cardiac vein, and it is traveling up, and it's also dumping its blood into the coronary sinus, and the coronary sinus is dumping all the used up blood from the heart into the right atrium. So the right atrium is receiving all the used up blood from your entire body. Right atrium receives used up blood from the superior vena cava, inferior vena cava, and the coronary sinus of the heart. Hopefully you guys got all that. It's not that hard to understand. You just have to work through it and figure out where you are in the heart. So we talked about coronary artery disease. You'll see it abbreviated as CAD, coronary artery disease. This means there's some kind of blockage of blood flow to the coronary arteries. If you have blockage, a blood clot, you have a plaque buildup from a cholesterol plaque buildup, and it's restricting the blood flow to the heart, that is not good. So if you know anybody that's ever had chest pain, they call it angina, is chest pain. People will say it's like this pressure sensation on their chest, like an elephant or something sitting on their chest. You can get pain referred up into your jaw, into your arm, radiating down your left arm. It's an awful feeling. Now, if you have an MI is a myocardial infarction. Myocardial is talking about the muscle of the heart. Infarction is meaning the tissue is died because of lack of blood flow to the cardiac muscle. MI, not good. And if you have coronary artery disease and they know where your blockage is, it's usually going to be, here's your LAD, the left anterior descending artery, is a huge, important artery. It's delivering blood to the anterior surface of the heart here. So that's going to be an artery that is blocked, and they're going to do a bypass. They call them coronary artery bypass grafts. Cabbage, you'll hear it called a cabbage. A cabbage times 1 means they've just bypassed one coronary artery. Here they're showing you a bypass. They're using a graft. They're grafting. They're taking a blood vessel from another part of your body, and they are using that blood vessel has a tube to bypass the blockage. They are sticking that tube in here. They're showing you in the aorta, and they are sticking it into the LAD. Here is the blockage. So they're bypassing the blockage so you can deliver oxygenated blood below that blockage. Here they're showing you coronary artery bypass graft times 2, meaning 2 coronary arteries are being bypassed because there's a blockage in them. Here they're showing you they've harvested a mammary artery, and they're using the tube from the mammary artery, and they're using it to bypass the blockage in the left anterior descending artery here. And here's the right coronary artery, and there's a blockage in the right coronary artery, and they're using another graft. Here they're using a vein from the leg, and they're bypassing the blocked right coronary artery. And they're plugging it in here. They're plugging it in from the aorta. Here they're plugging it in from the left subclavian artery, another huge artery up here to supply blood flow to bypass the blockage. Now, I am going to include this on your website somewhere so you can watch this video. I don't expect you to watch it now. Let me just show you what this is. This is actually showing you a coronary artery bypass.
Well, before we start, this is a 53-year-old gentleman who presented to an outside hospital with a foot infection, a toe infection. He's a diabetic and has been so for about 20 years. And during the hospital stay, they noticed an abnormal EKG and did a stress test on him, which is strongly positive for ischemia. And he subsequently underwent a cardiac catheterization, which showed high-grade triple vessel coronary artery disease. And he was referred to me for coronary bypass grafting since the lesions were not felt to be amenable to catheter.
So I'm not going to show you the whole thing here. Watch this. You will be amazed at how much you actually understand as he's going to go through a lot of the anatomy. He's talking you through the anatomy. He is showing you the coronary arteries where he's bypassing them. It is extremely informative, and it's so cool to watch them actually from start to finish doing the coronary artery bypass graft, sawing open the chest, going through the sternum with a saw, sewing up the sternum at the end with wires. It's amazing. So please watch it. I'll include the link somewhere. I'll give you the link. It's an amazing video to watch. Anyway, I hope this helps, and I still have one more heart video I'm going to do, and it's just kind of a total review of everything, and it hopefully will be real quick. So hopefully this helped you, and email me with any questions. Thanks.